Andy Deliveris, Program Director at the University of Wisconsin-Madison, Department of Ophthalmology and Visual Sciences. These surgery centers are extremely important to be able to get the dexterity, the movement, the temporal spatial relationships that is necessary to carry out a successful surgery. One thing that I'm really excited about is there's a big gap post-grad and how you keep your skills up. These sorts of surgical centers can be used to not only train our alumni with new Yamane lens insertion techniques, new things that come down the pipeline. I think it's an amazing opportunity for both the community and our alumni to utilize to learn these new techniques. You're really unsure, and the programs are really unsure about how good of microsurgeon you will be. We will both have a sense for how the individual will perform academically through their clinical studies as a medical student, but we don't know how they're going to perform as a microsurgeon. Surgical laboratories will allow people to be able to work on what they need to work on, and they're hugely important. And you really don't want that first experience to be on a live patient.
I like to get feedback as I'm learning a new set of skills, and having an additional person in the room, which could be my preceptor or the attending trying to teach me the first few steps of doing surgery, is really helpful. And having the type of space and organization and equipment to be able to do that is, I think, the first step to go with it.
Historically, these labs are distant, and it requires a lot of momentum in order to get into that space with a faculty member. And this, you can come down and grab somebody right, between clinics and show you certain things. So I think this is mind-blowing. I don't think that this space actually could be any better. It's just a matter of getting some fundraising, and I think we've got sound proposals, and this will be huge for our department. To our community, to our potential donors, and especially to our alumni and our graduating residents, because I do feel from the bottom of my heart this is the way we will give back, and we will be generational with our training. We couldn't do it without you. We appreciate everything that you have done for our patients while you've been here, what you've left behind, and taking what you've learned forward to many, many more patients. Thank you very much.